Hi, Dave from Ryan Hills Physiotherapy. So this week we're looking a little bit at frozen shoulder, what they are, why they happen, and what the best form of treatments are, and what we do with them at physiotherapy here at Ryan Hills. So just to start with, a little bit of anatomy with the shoulder. So you've got the most mobile joint in your body. It's got a wide range of motion. What you're basically looking at is you've got the scapula or the shoulder blade, and then you've got your humerus, which forms like a ball and socket joint up through here. Now, surrounding that ball and socket joint before the muscles go on is you have the capsule and the ligaments that blend together. And this creates like a sleeve around the joint, gives it a degree of stability, and it's formed of collagen and it's quite a tough fibrous structure. Now, in a frozen shoulder, what we know that happens, or what seems to happen, is it goes through three phases. And it seems to go from like an inflammatory situation where people might present in the early stages where it's mainly a lot of pain that they're struggling with. The range of motion might not be affected, or if it is affected, it's more limited by pain than by anything sort of tightening up. And what they reckon that's going on there is you've got an inflammatory condition within the shoulder or even in the bursa itself. And then that's creating like a synovitis. So the synovium, which covers the surfaces in the shoulder, synovitis gets very inflamed and very painful. So this is your phase one. So it's very much an inflammatory phase. And it can be mistaken just for like an irritable rotator cuff problem, a bursitis, or sometimes, like even a calcific tendonitis. It then sort of transitions into that phase where we start to get a bit of limited movement coming in. So not only is they've got a painful shoulder, but we've got a painful and limited range of motion. So we've still got this synovitis developing, but what we're starting to see is some of the ligaments that run through the front of the structures in the capsule are now starting to become a little bit fibrotic and a bit tighter. The interesting thing is if you see like a normal shoulder, like the capsule at the bottom doesn't sort of form like that. It's got this like fold, an axillary pouch. So when you lift your arm out to the side, you've actually got a bit of slack. So what's starting to happen sort of between phase 2 to phase 3 is because of this inflammation, it's creating a fibrosis and a tightening and a contracture of the shoulder. This pouch is getting smaller and smaller. So you've actually got less give when you lift that arm out to the side, so the movement starts to get restricted. And then you sort of get into the phase 3. This is probably a few months down the line, and the pain starts to go away, sort of dissipate, and what you're left with is this very, very restricted shoulder that's got a loss of movement. And then it can take quite some time till we get to the thawing phase, whereas that range of motion starts to come. Now, on average, these conditions can last from anywhere from a year to 3 years in total if they're left unattended. And it used to be sort of told, and sometimes people will still tell you that after 3 years they'll spontaneously get better, but unfortunately in about 20 to 50% of people they're still left with restriction in range of motion. And that's why I think it's a really important thing that we need an early diagnosis as quickly as we possibly can, and then we can get you onto the appropriate treatment path. So why does it happen? Well, there's two types probably, or two sort of ways that we can look at this. Number one is they can sometimes spontaneously occur. So for no reason, no trauma, no injury, you can start to sort of develop this really sort of painful shoulder that then develops into a frozen shoulder. And I think from there is an underlying factors that people may have. So in some people, like if you're diabetic or if you have diabetes type 1 or 2, they seem to have a higher risk of this. Some people with like cardiovascular disease seem to be at higher risk of this as well, much like they're at higher risk of getting carpal tunnel syndrome. Individuals that are partial or prone to Dupuytren's contractures, which is like a contracture of the tendon in your pinky, they seem to be a little bit more prone to it. And those sort of characters are sort of more got descendants coming from the northern European, Scandinavian sort of parts of the world. So it's like your Vikings are not very good at mobility, but they were really good at looting and pillaging. And then on top of that, there are elements in some people like autoimmune conditions that they predispose towards getting frozen shoulders even more. But just if you get a frozen shoulder, it doesn't actually mean that that's going to happen, that you've got one of these conditions underlying. But it just says there's an increased risk. Tend to find that women get it more than men by quite a considerable degree, so it's about 70% of women to about 30% of men. But the good news is that women respond to treatment an awful lot better than men do. Probably the most common way we see it is sometimes as a complication post-surgery or post-trauma. So people have had a fracture, that have fallen, broken their arm, maybe had some sort of large rotator cuff surgery, repairs, slap lesion repairs, even reconstructions, that the trauma of the surgery and the trauma of the incident that brought them there can then create this frozen shoulder situation. So really that's what's going on. So it's a poorly understood condition, and I think really what it is, it's really an umbrella term, and there's many sort of roads that can lead to it. However, if that sounds a bit doom and gloom, it's not really. It's really about identifying that you've got it or you don't have it, and then putting you onto the appropriate treatment path. So that's a little bit about the anatomy and the physiology of frozen shoulder. Next time we'll have a chat about the various forms of treatment and what we can do for it. Okay, I hope you found that useful. Enjoy your day. Remember, keep your masks on, socially distance, take care. Bye-bye.